Hello guys. First I want to say thank you for attending the in-service. As you guys saw the flyers posted around, this is a bedside reporting in-service. The reason for this in-service is because we now have a bedside reporting policy. So we're going to be going over that and kind of just letting you guys know the importance of abiding by this policy. The reason I picked this subject is not just because I had to do it for school, it's because it's really something that means a lot to me. I think bedside reporting can improve our patient outcomes and safety and satisfaction. So the goal of this in-service is to improve patient outcomes and safety by improving communication between staff and the patients. The objective is to provide an in-service on the benefits of bedside reporting and initiate a bedside reporting policy in the intensive care unit by April 10th. Also, a handout and flyer have been made that will be distributed to you guys. You guys have already got a copy of the handout. It looks like this, and like I said, you saw the flyers. So first, we're going to just start talking about why bedside reporting is so important. As you know, bedside reporting is when you go to the bedside instead of just doing a report at the nurse's desk. This is important because for number one, it improves patient safety. I don't know if you've noticed, but the time that we're at the nurse's desk doing a report, it's 15 to 20 minutes. The patients are in their room unattended for that complete whole time. So going into the patient's room and doing bedside reporting is just a better way to make sure that the patients aren't alone for that extended amount of time. Also, it's going to improve patient satisfaction. A lot of patients say that they don't feel like that they're involved enough with their care, that their voice is not being heard. So by doing bedside reporting, we're going to be going into the room and involving the patient and their family, if they choose for their family to be involved, in the report so that they feel more like their voice is being heard. Also, it's going to be decreasing the risk of medical errors. As you'll read in the policy, once we go over that, it says that we're going to be going into the patient's room, pulling up the MAR on the bedside computer, and reviewing medications that haven't been given, medications that haven't been verified yet that we're going to be given, new medications, so that way we can kind of have a discussion, make sure that the medication that pharmacy profiled is the right one, so we can kind of cut back in that kind of medical error. Also, it's going to just facilitate healthy communication between the nurses and between the family and the patient. Sometimes the family, they want to be involved and they want to know what's going on with their loved one. So it's a good way to just involve the family as well. One important fact about bedside reporting, with that being said, is that the Joint Commission every year they come up with some safety goals. One safety goal for this year is to improve communication amongst staff. Actually, bedside reporting satisfies this goal completely because when we're doing bedside reporting report at the nurse's desk, we're not really looking at the patient. So when you're actually looking at the patient, a lot of other stuff's going to come to mind, and you're going to think, oh, hey, I forgot to tell them this at the nurse's desk, so now I'll let them know. You know, for example, urine output. They haven't had that great of urine output. You may want to watch. But when you're assessing the patient and you look at their Foley, that helps you remember that. So that's a great way to improve communication between staff and satisfy that Joint Commission goal. A lot of you may ask, what about HIPAA? You're worried about the HIPAA part, about breaking the HIPAA laws. Well, in the back of the bedside reporting policy there is a brochure, and what that brochure is going to do is we're going to hand that out. There'll be some out in the supply room at the beginning of every patient's admission in their little book, in their little pamphlet we give them. This kind of just highlights what bedside reporting is. It's just a short little paragraph the patient can read over, and if they can't read, you can read it to them. It'll just let them know, that at the end and at the beginning of every shift, the two nurses are going to come in. They're just going to go over what's going to be going on with them throughout the day. Now, they can choose right then and there, I have private information. I don't want my family to know about that. So then go into the room, ask the family to leave before you start bedside reporting in a kind way, and then you can get them, once you've assessed the patient, done bedside reporting. Or the patients may want their family involved, especially elderly people. They may want their grandson or their granddaughter or their caregiver or their family to be there so that they'll know what's going on, because they have a hard time explaining this to them. So that will be in the bedside report policy. Let's see here. Okay, so now we'll go ahead and go into the actual policy. If you could pull your policies out, you'll see that it's not very long policy, so you shouldn't have a hard time reading through it. And there will be copies of this. Every one of you can keep your copies, but you can also find a copy of them in the file cabinet listed under bedside reporting. At the top of the bedside report policy, it says the scope is for all registered nurses employed in the intensive care unit at Beckley Appalachian Regional Hospital. The purpose is to provide guidelines for consistent bedside shift report that will help aid in nurse-patient communication, assist in providing high-quality patient care, and help create a standardized shift report. Because like I said, that's the reason we're all here. We're all here for the same outcome, is to provide high-quality, safe patient care. We want to make sure that our patients, this is somewhere that they want to come back to. So this bedside report policy is a way to start that. It's a way to get that ball rolling. Okay, so the procedure is, there's also a sheet here that you can grab right here in the supply room before you start your shift. This is the one very similar to the one we've been using. It's just kind of a few things added. So you can review that. This is what you will do at the nurse's desk, just as you have been. It's kind of the detailed information, room number, allergies, code status, diagnosis, diet, activity, all the normal. Then that's when you'll go into the patient's room after you finish that. In the patient's room, you kind of want to introduce yourself, introduce the oncoming nurse, and build them up. By build them up, I mean say, your nurse today is going to be Marcella. She's a great nurse. She's been here for however long. She's going to take great care of you. You guys will have a great day. And that kind of helps build rapport between the patient and the new nurse. Then you want to introduce yourself to any family members that are there. Okay, this report is more detailed. This report, you're not going to go into every single thing that you read on this page. You're just going to go over the highlights. Okay, this is Mary Smith. Today, they're going to be going down for an EGD. She is NTO for that procedure. They said they would be up to get her around 12, and then after that procedure, she can eat. See, that helps the patient because they're starving, for one. They haven't eaten since midnight, and they're not going to get to eat breakfast. So by doing this bedside report, it's letting the patient know, I just have to make it till noon or so, and then after I come back, I can have lunch, or I can have dinner. That helps ease their mind, because if you're laying in a hospital bed, you do get agitated and just irritated knowing that you can't eat. So, and another thing, like if you have a post-op patient, you can go in, and this is John Smith. He's here for a post-op knee replacement on the right knee. You want to assess that dressing, assess any drains that are there, and then he's getting pain medicine every 4 hours, morphine 2 milligrams. So, and the next time is at 9 o'clock. So that lets that patient know, okay, I can have that pain medicine again until 9. And that's going to help you, because even though you don't have to tell them this, that's going to keep them off the call bell until 9 o'clock. After you assess them, you can go chart, do what you have to do, and then around 9, take the pain medicine in. If not, they're going to be on the call bell. It's just going to help you with your time management skills. This is also the time that you're going to want to say their current diagnosis, their diet, their pain status, code status. The major things, you're going to look at all their lines, drains, wounds, dressings. You look at their IV access, and you can even check that with a saline flush. And if you don't have good access, you can maybe say to the nurse that's off going, do you care to run and grab me the stuff for an IV, and I'll go ahead and get that done so that we can get these medications in. You're going to want to also check your IV pumps and make sure that they're all set right, especially we're in the ICU. If you have critical drips, you're going to want to make sure that the pumps are set up correctly. You're also going to just assess the environment, that it's clean. If there's any trash in the floor or the garbage cans, we'll just take care of all that stuff at the beginning of the shift. And of course, you're going to use your nursing judgment. It says here at the bottom, please use nursing judgment for special consideration on which information to include at the bedside. It's just common knowledge. You don't want to go in and say, this patient has a history of Hep C, this patient has a history of sexually transmitted diseases. You know that. So you want to just give the main pertinent information that's really going to affect this patient. So that pretty much goes over the policy. And like I said, you guys can keep your copy of the report. And it also has some very important facts on here. For instance, The Joint Commission estimated that 80% of serious medical errors involve miscommunication between caregivers during the transfer of patients. So, as you can see, this bedside reporting policy is really going to help with this. It helps just to help with this. It helps with the flow of care from one patient to another, from one nurse to the next. And another fact is that medical errors are the third leading cause of death in America. So that's something we as nurses in this ICU can help cut back on, is that medical error. And do you guys have any questions, or if you do, we have time for that. If you need to review the policy again, the thing is, if you abide by this policy, you guys are going to get rewarded. Tara Neal, our nurse manager, and I will have lunch and breakfast tickets for free breakfast or lunch. If we see one individual that always does this bedside report that we feel like is really abiding by the policy, you'll get one of those. The bad part about it is you're going to also be held accountable if you don't comply with the policy. If a nurse is found to not be complying the first time, you'll get a verbal warning by management. The second time, it will result in a second verbal warning and also a re-in-service. Either Tara or I will re-in-service you to re-educate. The third time will result in being written up and may even be on your yearly evaluation. But I know you guys, I have confidence that we're going to do this bedside reporting policy to the best of our ability. So this should not even apply to us. And if there's no questions or anything, I hope to leave on a good note, and I hope you guys can see where we're going with this policy and know that it's just here to improve our patient outcome and satisfaction, and also our communication with each other. Because again, we're all on the same team, striving for the same goal. Thank you guys.